I'm Amanda Clark from Great Ideas in Nutrition. If you've ever used Medicare subsidised visits to see a dietitian or another allied health professional here in Australia, you may be familiar with the GP management plan. Now that's often called a CDM or an EPC or a care plan. But as of July 1st, 2025, there's been some changes. So let's walk through what's stayed the same, what's changed, and what this means for you and me. Well, what hasn't changed is that you're still entitled to 5 subsidised visits per calendar year to see allied health professionals like dietitians, physios or podiatrists. The current rebate is now $61.80 per visit through Medicare. The referral for these visits is still initiated by your GP, and your GP remains the central coordinator of your care. So who's eligible? Well, many people are eligible and simply don't know it. You may qualify if you have a chronic health condition lasting 6 months or more, like diabetes, heart disease, arthritis, PCOS, irritable bowel syndrome, or obesity. It's up to your GP to decide if you qualify, and you need to have complex care needs, meaning you would benefit from a team of health professionals working together. Your GP makes that final decision, but if this sounds like you, it's worth asking. So what's changed as of July 1st, 2025? Well, your GP must now complete a shared care plan, so it's a little bit similar to how it used to be. And that needs to happen before any visits can proceed. So as usual, it includes a brief summary of your goals and your healthcare team. There's a bit more emphasis on collaboration between your GP and allied health providers, and for your GP to follow up and review your plan regularly. So that might require longer or separate GP appointments. Interestingly, there's no longer a standard referral form. Instead of that familiar form listing your 5 visits and the providers, you'll now receive a referral letter. Now, it may or may not say care plan referral, but including those words is really helpful for us, because to be able to issue a rebate, we have to set up the appointment with a specific Medicare code, or the rebate option just doesn't appear for us. So we need you to tell us when making the booking that you want to use a Medicare rebate, and then we'll have it all ready to go. The referral also won't say how many visits you have with us or how many are intended for each provider, because those are no longer specifically allocated. You can now take the referral letter to any allied health practitioner in that discipline, so not just the one listed. So if you have a referral made out to a different dietitian, you can now use that with us. It's up to you to decide how to use your 5 visits. So for example, 3 with a physio and 2 with a dietitian, or 5 with the dietitian. It's your choice. Practitioners won't know how many visits you've used or intend to use, but somehow we're still expected to write back to your GP on your final visit. So it's really handy if you tell us when you've had your final visit. I'm told that you can check how many visits you've claimed via your myGov Medicare portal, so just take a look. If you've never had a care plan referral, you can ask your GP if you're eligible. It's worth over $300 to you in rebates per year. You can still get these rebates with packages of visits with us too. So, for example, we have a package of 6 review visits. The full value of that is $564, but you then get a discount for paying up front for the package, which brings it down to $470. And then there is a potential for $309 in Medicare rebates along the way, resulting in a final out-of-pocket of $161 for 6 visits, and that's less than $27 per visit. It's all worth exploring. When you're wanting a referral, you probably need to tell your GP practice that you want to talk about one, because they may want to book a longer appointment to create that shared care plan. Request a letter for each of the allied health providers that you plan to see, and then keep track of how many visits you've used throughout the year. We're committed to helping you navigate these updates despite the difficulties. We know the new system gives you more control, but it also puts a bit more on your plate. So if we seem a bit uncertain about how many visits you have left, it's because we won't have clarity anymore. So please bear with us, and we'll do our best to help you get the care that you need. Thanks for watching.